The following is a local resident producers program. The program content is the sole responsibility of the producer and does not necessarily reflect the views or policies of CATV2, Oshkosh Community Media Services, the City of Oshkosh, or Time Warner Cable.
Everybody, welcome to Eye on Oshkosh. I'm Cheryl Hentz, and joining us this evening is Jeff Phillips. He is the Environmental Health Supervisor for the Winnebago County Health Department, and welcome. We're very pleased to have you here.
Thanks for having me. I appreciate it.
The main reason why I asked you here is earlier this week I got a press release from you, or maybe it was last week anyway. I got a press release from you, and it talked about how the County Health Department and the Oshkosh Health Services Division have been working together with a community team of about 30 members, I guess, for what, about 8 or 9 months now, I guess?
Yeah, it's been just over a year from the time we started the process to where we are now.
And you've been putting together something called a Community Health Improvement Plan, better known, and we'll be referring to it throughout the next half hour, as CHIP. But this is a plan that helps to improve the general health outcome of people living in the city and the county. And I was really intrigued by the email and the press release when I got it. And I don't think it was in my email inbox for more than probably 2 or 3 minutes, and I had called you and said, you know, this sounds interesting and I'd like to have you on. So thanks again for coming.
Yeah, well, thanks for the opportunity to talk about it. It's a pretty neat process that we went through, and I think we'll get to that as we go through the show.
Sure.
But it's one of the few times that the two health departments in Winnebago County, the City Health Department and the Winnebago County Health Department, have really worked together on a plan or on a process, and I think that was really a good learning experience for us.
Well, and one thing that sort of intrigued me as I was looking over some of the material, and even just the two health departments that have been kind of working on this together, is it's the County Health Department and the City of Oshkosh Health Department. And I thought, well, gee whiz, we've got, you know, other cities, none as large as Oshkosh in Winnebago County, but Neenah and Menasha are there, and there's Omro, and I thought about their health departments. Were they invited to participate in this, or what happened there?
Yes, the cities of Neenah and Menasha have partnered with the City of Appleton to do a community needs assessment, which included some surveying and was really geared towards the more urban areas of the county. So they chose, you know, the 3 larger cities chose to kind of put their monies together and their expertise together and run it that way. The smaller municipalities, Omro, Winneconne, all of the townships are represented in our CHIP plan.
Because they are part of the Winnebago
They are
County.
Winnebago County's jurisdiction.
Now, because Neenah and Menasha and so forth went with Outagamie County, their residents will still benefit from this, however, or will they benefit from something Outagamie County is doing, or can they be double dipping here?
Well, I think the benefit is there all the way around for everybody. Okay. Certainly the things that came out of our CHIP are things that are going to impact the cities, those two cities as well. Because the goals that we have and the strategies we have are very broad. They are open to everybody. We're not going to be excluding people from participating in anything. So certainly, you know, the things that come out of our plan and some of the objectives that occur and some of the things that occur in the community, certainly can benefit all of them.
Okay. Well, it's been a kind of an interesting process, I guess, as I look at the material. It seems interesting anyway. And, when we talk about healthy lifestyles and health initiatives and so forth, we're not talking about health insurance here. We're just talking about lifestyles and things that people can do to improve their overall health. But that's such a wide,
Yes.
all-encompassing area. And you guys have broken it down into 4 areas. And, before we get into those 4 specifics, maybe we can talk a little bit about the process that you've done to get to where we are today. What's been going on for the last year or so?
Sure. And actually, if we step back a little bit further, in Wisconsin, public health departments are required every 5 years to do a community needs assessment. And the community needs assessments in the past typically were the health department would gather up a bunch of information and data and look at health trends and do some analysis. And the health department themselves would make the decision as to what programs to offer and what kind of things they were going to work on. Sometimes that was coupled with maybe a telephone survey, or sometimes that may have been coupled with a behavioral risk factor survey where the health departments would get a little more data. They could glean some information from that. What we did is we took it even a step further and kind of flipped it around. And instead of the health departments leading the effort and making the decisions as to what we want to offer our citizens, we actually went to the community and said, what are the things that we should be working on? What types of issues are important to you? And how can your health departments better serve the residents of the community by doing what they want? So that's kind of the gist for CHIP. The way we worked it was about a year ago, the 2 health departments kind of got together, put together a planning team, which included staff and the health officers from both departments. And we kind of kicked around the idea of how this would lay out, how we could work through the process, kind of gave us a framework of how that was going to go. We invited the UW Extension folks from the Oshkosh Extension office to help us as facilitators and to kind of keep us in line and kind of make sure we did the right things. But our first step then was to identify people within the community that we could utilize as partners, who we could bounce ideas off of, and who could represent the various sectors of the community. Okay. So our first crack at it was, we sat in a room and we just wrote down everybody that we could think of and what organization they may represent and what they had expertise in. And over time we kind of narrowed that down, and we ended up with about 30 representatives from, as I said, all different sectors of the community. We had people from law enforcement, from fire, the schools, nursing homes, pharmacies, the business community, all 3 of the hospital associations, and really that was then our community team. So they came together for the first time in July of last year. Okay. And we gave them a little bit of information. We kind of explained the process to them. And then when they came back for the meeting in August, we prepped them with a couple of PowerPoints and kind of gave them some background information of what the health departments were all about. In September then, we asked them to come back for the September community team meeting and bring along some friends or family or other people in the community that we wanted to just glean some information from. And we termed that our visioning experience meeting. And what we did is we just put them all in a big room and said, what does a healthy community look like? What is the quality of life here in Winnebago County and the city of Oshkosh? What's good? What's bad? What do you like? What do you want to change? And out of that visioning exercise, we came up with 8 different themes that kind of emerged from there. So we kind of crunched that all together, and we looked at it and we put things together that were similar. And then in the latter part of last year, the health departments kind of went back to the old way of doing needs assessments. And we looked at the data that was out there, we looked at trends, we looked at health outcomes, and the health department staff then presented that in the fall of last year to the community team. And out of those several meetings where we looked at data issues, we came up with 11 different possible themes. Okay. So in December, we gave a homework assignment to our community team, and we said, we have these 8 themes on one side, we have 11 issues on another side. we want you to go through a process, score them, rank them, come up with the 3 things that are most important to you as the community team member. And then, so in January, we all got together, December we all got together, and then again in January, and we went through all of those different things, kind of squeezed things together, mixed them all up, put things together that were similar, ended up with 4 priorities.
Okay.
So that's what made it into our plan. So those priorities, while they're very broad, they do have buy-in from the community, and certainly there are things that we can work on. There are things that will have systemic effects. There are things that have possibly multiple positive outcomes, and there are things that are important to the community, and that's the key.
Sure.
So that's what we're with, is with our 4 priorities. We put those into a written report. We looked at a lot of information on best practices and things that are strategic, that have a good possibility of succeeding, and those are the things that then went into the final draft of the plan, which was then released the end of April.
Okay. And we do have the address of where you can go to look at this plan. It's at the county's website, and I'll just, in case it hasn't been up on the screen yet, it's www.co.winnebago.wi.us, and then the / and then the word health. And when you go to that website, we will be putting it up again several times during the course of this segment. But when you go to that website, you kind of have to look at the middle of the screen, and you'll find it under the section that's labeled administration. I learned that myself the hard way, because I'm like, where is this?
Yeah.
So, but it is there, and it jumped right out at me once I saw it. But I couldn't find it for the life of me at first. But they can find a lot of these things that we're talking about here tonight, and a whole bunch of other information.
Sure.
So let's talk about the four core areas, if you will, that you guys have come up with.
Yeah, the priority areas that we chose as a community to work on are healthy lifestyles, which really gets at things that kind of challenge the social norms, personal responsibility, getting people involved in different things that support a healthy lifestyle. Reduction of tobacco use, reduction of alcohol use, healthy eating, exercise, all of those kind of things. Taking control of your personal life and your family's lives, and just doing things that make us healthier. The second one is physical activity, which really then gets at exercise and doing things, making changes in our lives where we get 150 minutes of exercise a week, which is what we figure is needed to maintain a healthy weight, to maintain a good active lifestyle. It also gets at developing partnerships with businesses and with places in the community where you can exercise. We're envisioning things like maybe working out some kind of employee wellness programs, or the idea of possibly having work sites where there are access to showers or things like that, where people can ride their bikes to work, or they can walk to work and get into some physical activity that's part of their normal routine.
Okay.
The next priority is overweight, obesity, and type 2 diabetes. This came out because Winnebago County has a overweight and obesity rate of about 28% of the population. And with that then comes a mortality rate, a morbidity rate for diabetes of almost 32%. These two factors really are things that we feel can be addressed not only through activity and through the healthy lifestyles, but also through some very strong counseling on nutrition, working at coming up with a very collaborative effort with the health services to get at management of people's disease, to get at the things on the upstream side of it, healthy nutrition as a child, even getting into promoting breastfeeding as a way of controlling weight in developing children, and just really doing things on the upper end before we have to deal with the outcomes where people already have a disease. Now what do we do? And the last priority we have is healthy recreational opportunities. And this gets at things like walkability and the use of the natural resources and green space and open areas and the idea of getting used to biking to work or carpooling to work or getting out and participating in some of the activities that are already out there. The Walk to Win and the things like the 5K runs and all of those kind of things that are going on in the community. Really tying into that and making it normal for people to see us biking to work or walking to work or being out at during your lunch break, walking the trail systems or doing something like that, just to maintain that healthy lifestyle. And and obviously all of these things kind of tie together.
Sure.
But they're all getting at the core things that need to be done to improve our health. We don't want people concentrating their health care on after something occurs. We want them really to be looking at prevention and the things that can be done ahead of time to make us all better.
Proactive as opposed to reactive.
Exactly.
Okay. So, I didn't have a great deal of time, honestly, Jeff, to look at everything that was on the website. And I know that this is sort of a 5-year plan, if you will, to kind of, put all this in place. And even at 5 years, I think that's pretty good because this is massive.
Yeah.
I mean, this is huge. So during the course of the 5 years, will people be seeing the website updated and tweaked as you roll out more parts of this?
Oh yeah. Yeah,
Okay.
At this point, what's on our website is really just the plan. We're in the process now of putting together implementation work teams that will actually develop some of the objectives and some of the more very specific things that are going to be done to implement this plan. The plan is very broad. It has goals, it has strategies, it has best practices in there, but it doesn't really say, okay, the Healthy Lifestyles work group is going to do this, this, and this. That's going to be left up to the work groups to decide. So as we start developing those work groups, the people that are on those work groups or some of the things that they're working on, some of their objectives will certainly be transferred to our website. We're also anticipating that this information will go up on the city's website. I know it's not there yet, but I know the City Health Department is going to be working on putting that on their website. We're also anticipating that because we're tying into existing programs in the community and into the programs that are being offered by the health systems, we're anticipating that some of this information will also start to be distributed through other venues. I know Affinity has been very helpful and has been very helping us to promote some of the plan already, and I've met with them several times. And I'm sure the other health systems will also come on board since they were all parts of the community team. But I would see that as we get rolling, a lot of this stuff will be coming out from various venues and from various locations.
Okay. So if I'm a viewer sitting at home, I'm listening to this and I'm saying this all sounds great, how will I specifically benefit from this?
Sure. One of our big challenges is to do that social marketing piece that makes behavioral change something that is viewed as not only benefiting the individual, but also as benefiting the community. And to do that, we need to start changing social values and looking at the things that we consider to be normal. That will be a piece of it. That whole marketing tool, public health has not been really good at marketing. So certainly we're learning as we go along. But I think for most people, at this point, I would say, view our plan, see what's in it, look at the priorities, and if there's something that an individual is interested in, or if they want more information, or if they want to, get on an implementation team and really see this thing take some legs and become, come to life, certainly anybody can volunteer to assist in this process. They can contact us through the website at the health department, the Winnebago County Health Department. They can send us an email at health.co.winnebago.wisconsin.us. They can contact me at my work email address. But we would really like to see people from the community step forward, take some issue with this, take some personal responsibility, and really improve their own community. You know, there's a lot of things that can be done, a lot of information out there, a lot of ideas that we haven't tapped into yet. You know, I would welcome, you know, anybody that would step forward and help us to lead this effort.
So it's not like they would need any kind of background or education in health or health assessment or anything like that. Just if they're interested in this and they want to participate and kind of give back to the community while at the same time helping to shape something that's going to help the community as a whole.
Yeah, by all means, we're all for it.
Is there any limit to the number of people that you can use in these different groups?
No. We're just getting started. You know, most of our work groups right now probably have 6 to 10 people on them. Certainly, I would, you know, because we're talking something for the betterment of the entire community, meaning pretty much everything within the borders of Winnebago County. You know, I think the more citizen involvement we can get, the more citizen groups, the volunteer groups, the nonprofit organizations that are out there, gosh, if we could get buy-in from all of them, that would be fantastic. Because really, this is a plan to improve the people of the county. You know, we don't want it to be led by the health departments. We want it to be led by the community.
Sure. And again, the email address is health@co.winnebago.wi.us. And the phone number, I assume this is not your direct number, but it's just a general number for the health department. It's 232-3000. So that's 232-3000 or health@co.winnebago.wi.us. Now, you know, as we've mentioned a few different times, you know, this is a huge undertaking. You've got this 5-year plan there. You're going to be promoting this and doing a lot of, you know, PR work, if you will, other than things like Eye on Oshkosh, and I'm grateful that this is probably one of the first places you've rolled this out at.
Yes, it is actually.
All right, excellent. Well, I'm proud of that. Yay. What other things are you going to be doing? What is on your plate as far as where else you're going with this?
You know, at this point, that's kind of open. You know, we will be, you know, certainly meeting with the governmental officials. I've been asked to consider, you know, presentation to the county board. Obviously, a presentation probably to the city council as well. We're asking, you know, organizations that are out there, citizens, civic organizations, give us a call, contact us if you want us to come out and take a look or to give you a presentation. We're developing a PowerPoint presentation that could be used by pretty much anybody that's been involved with the program or with the process, just to get the word out there. We will be conducting a marketing training for the implementation teams, and we'd also like to bring that out to a wider audience within the community. Again, you know, touching base with some of those other organizations and agencies that are out there. You know, we're hoping to tie in with programs that are going on at the rec departments and at the YMCA and, you know, with churches and with, you know, the things like the Rotary and Kiwanis clubs, those type of things. Typically, that's where we're kind of used to getting the message out to. So we're going to continue that. I mentioned before I've been working with Affinity. I will be giving a presentation to their staff. And they have also volunteered to assist us with writing a grant, possibly for a $50,000 development grant, which would help us put some funding to some of these programs, maybe put a coordinator on board for us that could kind of lead the effort a little bit more, do a little better job of marketing than we're able to from the health departments. You know, this is just one more project that gets put on the plate with the rest of what we do. You know, we realized it was going to take some time, but we thought it was important, and we really wanted to get out in front of it do what we can. But as I said before, I really want this to morph from being something that's being directed, if you will, or led by the health departments. We really want to get community involvement, and we need to find champions within the community that can take this thing and begin to run with it on their own. That's really where we want to go.
All right. Well, and as part of your PR plan, if you will you be having, so many places now they have Facebook pages and they do Twitter, they send out tweets.
Yep.
I don't know about the whole Twitter thing, but I can see where Facebook would definitely be a benefit to you guys here. Do you have plans in the works to have a Facebook page?
Yeah, actually the county health department does have a Facebook page already.
Okay. Will there be one specifically for CHIP?
That we haven't discussed yet.
That might be a good
my
idea,
guess
Jeff.
is we probably will. We've been kind of relying on the health educators that we have in-house to help us with that. Some of us are out of a different age, I believe, that Facebook doesn't necessarily become something I'm very comfortable with. But our health educators use it quite often as part of their tobacco program and as their drug-free communities program. So we're kind of relying on them when they've got time outside of their other programs to really help us out with that. Certainly Facebook and Twitter are going to be things that we will be involved with. Beyond that, I'm not sure. This is kind of in a developmental stage for us. Our planning team is continuing to meet, and I think the planning team will have some ideas as to how best to get the ideas out.
Sure. Now, if someone's going to give a call and they say, "Hey, Jeff," or whoever answers the phone, "I kind of want to work on one of these work groups for the CHIP program." What kind of a time involvement is there? What kind of time commitment do they need to give? Do you meet once a month? Is it once every couple of months, or what are they looking at here?
That's really going to be left up to the implementation work groups to decide for themselves. The way we're setting them up is that we are when we get a large enough group together to call a meeting of the work group together. We have a person assigned from one of the health departments that's a liaison that will assist in starting it up, getting the information out, getting the right people contacted. But we're really hoping that, and we're telling our liaisons not to lead the effort, but to find somebody that's volunteered that can chair that group. And then the group themselves will have the authority, if you will, to meet as often as they want or as little as they want, to develop whatever objectives they want, as long as they meet the goals and the strategies that are in the plan. So there's a lot of ability to freewheel, there's a lot of ability to come in, be a member of the team, but the time commitment is really going to be left up to the individuals and to the work groups to decide for themselves.
And do they get to choose which of these 4 work groups they'd like to be on?
Yes.
Okay.
Yes, and again, that's the thing. If somebody's interested in recreational trails, by all means get on the recreational opportunities one. If somebody's interested in, how to prevent diabetes or how to, make better healthy food choices in the schools, well, maybe they want to get on the obesity and the diabetes work group. The people that are on the physical activity work group already are people that are involved with safe routes to schools and walk to win and those kind of things, where physical activity is being built into the day-to-day routine.
Okay. All right. Well, again, I would encourage folks, if this sounds like something at all that you'd be interested in, I would encourage you to give a call and get on one of these work groups, because, it's not just the usual. I saw a lot of names of the typical movers and shakers in the community, but you know what? They can only be involved in so many things, and they really rely on the help of everybody to do something.
Yes,
so
that's
I'd
exactly
encourage
right.
folks to do that. So anyway, thanks very much for being here.
Thank you very much.
We appreciate it so
Appreciate
much.
having
We're going to
being
take
here.
a very short break, and when we come back, we'll be joined by 2 folks talking about the WINR program. We'll be right back.
All right. Well, thank you very much.
Sit tight for a second.
Dear Mom and Dad, well, I finally have some time off, so I'm writing to tell you that I'm doing well. We have good days and bad days over here. We try to remember the good ones and get through the bad ones. Mostly we have each other, and that's what keeps us going. And Mom, since you asked, if anyone wants to help, just tell them to contact the USO. You can't believe how much they do for us. With love, your son, Michael.
Every year, the U.S. Department of the Treasury receives about 1.4 million reports of problems with paper checks. Checks can be lost, stolen, or delayed. If you still receive Social Security payments by paper check, Treasury wants you to know about a safer, more convenient way to get your money. The Direct Express Prepaid Debit MasterCard. The Direct Express card is new and is available to anyone receiving Social Security benefits, even if you don't have a bank account. Your monthly benefits will be automatically placed onto your card account each month on the day your money is due. While other debit cards cost money, it is possible to use the Direct Express card for free to make purchases, pay bills, and get cash at thousands of locations nationwide. There are no sign-up or monthly account fees. No more waiting for the mail or worrying about lost or stolen checks. Call 1-877-212-9991 or visit www.usdirectexpress.com.
We were in an emergency situation. We don't have extra. We have a little bit of water and a little bit of food. A meeting place, no.
No.
I don't think we have a first aid kit.
We have tuna fish, we have
Right.
beans, we have canned tomatoes,
True.
you know.
That's true, but that's really not survival food. Tomato paste.
Yeah, well, yeah.
We're talking about the shininess.
All right, we're back for the second half of Eye on Oshkosh. Thanks for staying with us here. And we're joined now by Gary Wilner. Gary is to my left, and Steve Sagmeister to my right. Gary is the president and CEO of WINR, and Steve is the WINR director of the Oshkosh Community Bike Program. And we're going to find out exactly what WINR is and what it does, and then Steve's going to tell us all about the Community Bike Program. So I guess we'll start with you, Gary. What exactly is WINR? And that's WINR, and that's an acronym. Tell us what it stands for.
It stands for, actually, let me give you a little history first.
All right.
It used to stand for Winnebago Interfaith Needs Response.
Okay.
And then as we grew, we found that became a description of a limited area. So we had to expand it to Wisconsin Interfaith Needs Response.
Well, you know what?
Both with W's.
Now that you've said that, I better have the crew check how I entered it in the computer, because I may have entered in the old meaning rather than the new one. So it is Wisconsin
Interfaith Needs Response.
Interfaith Needs
Yeah.
Response.
Right.
So if the crew can just double check that for me, it should say Wisconsin as opposed to Winnebago if I don't already have it that way. So okay. So exactly what does that mean exactly?
Well, the group formed in 1997 as a result of welfare to work. Several people in churches got concerned about whether or not people were going to drop through the cracks with that transition. So what they did was called all the health and human service agencies together to look for gaps. And what they discovered was there was a definite problem with transportation, people getting to work. Transit systems do an excellent job, especially here in Oshkosh, but they are geographically limited, they're time limited, and folks have to get average of 25 to 30 minutes driving time to get to work. So you've got to have reliable personal transportation. So with that, they worked with several agencies to help get the connection, the bus connection, transit connection between the Oshkosh area and the Fox cities that didn't exist before. They also worked to expand a ride on demand, which was a taxi service, but it still wasn't meeting the long-term need. So they developed the WINR Donated Wheels program. And in that program, we take in donated vehicles, we fix them up so that they'll do a minimum of 2 years or 20,000 miles. And then we provide those to folks who need them for employment and are at 200% of the federal poverty level or below. And those folks have to go through a maintenance class. They have to go through financial counseling so that they understand what they have to do to maintain that vehicle. And then they go through an interview process so that they can be prioritized. We provide vehicles to those that are in most need, not those folks that have been on the list the longest.
Okay.
And so then when a vehicle comes in, we match them up with a client and off they go.
Well, how many vehicles would you say you get like in a year's time? And I realize it's kind of hard to say, but just sort of on average.
We get about, it depends on the location, but in total probably 70 to 80 vehicles a year. The problem with what's been happening lately is a lot of those vehicles now have been hung on to for much longer because of the problems with the economy. And we're getting cars that need a lot more repairs in order to get them out there.
Sure.
But,
and of course, if someone makes a donation, this is totally tax deductible for them.
it is.
Okay.
And there's a major tax advantage for giving any vehicle that you donate that is used within the mission of the organization gets full Kelley Blue Book value. Now,
wow.
if you give your vehicle to someone who then sells it or auctions it to raise money, which most of them do, the average auction value is about 30% of the Kelley Blue Book value. So there's a tremendous incentive for folks to donate their cars to an organization like WINR or a church that might use it for their mission within the mission.
Well, Gary, you mentioned that it went from Winnebago to Wisconsin, and I assume that happened when you expanded out to like 9 different counties.
That's correct.
What are the 9 counties that WINR covers?
Okay, by the end of 2008, we were in Marathon, Portage, Adams, Waushara, Waupaca, Brown County, Outagamie County, Calumet, and Winnebago.
Wow, that is a huge
and if
area.
I didn't miss one in there
I wasn't
somewhere, I think it's 9.
I wasn't counting. But that's a huge area.
It is.
How large of a staff do you have to cover that kind of a geographic space?
We have 2 full-time, actually 3 full-time people and 1 half-time person.
Okay.
Covers all of that.
And are they located here in Oshkosh as you are, or are they kind of spread out?
No, we have 2 people here that are headquartered in Oshkosh, and that's the center of our operations. We have 1 in Fox Cities and 1 in Portage County.
Okay. We touched a little bit on the Donated Wheels program, but you guys have other programs too. And one that really fascinated me was the zero interest loan program. You and I were at a little get together a couple weeks ago, and we were just talking about this. And my eyes got pretty big when you were telling me about this because I didn't know anything about it. And I think it's a wonderful thing that people are able to take advantage of. So why don't you tell us a little about that?
Well, the zero interest loan program started in southwest Wisconsin. CAP Services there initiated a program about 9 years ago. And as a result of their tremendous success in providing zero interest loans that were subsidized by the Department of Transportation, they were able to put a lot of people in vehicles. So the DOT said, we want to spread this around. And they were looking for organizations like ours involved in transportation and covering a large area. So they came to us and asked us to bid for that package. So what we ended up getting was a $360,000 grant from the Department of Transportation to provide these zero interest loans for folks. And we have, we differ from other areas. You can set up your own program. So ours has 3 components. The first is a vehicle purchase portion of it, and a person can buy up to about a $3,500 vehicle or $4,000 vehicle in that range. And the second part is for major repairs above $500 and averaging about $1,000, and then below $500 where we can provide not only loans for that to happen, but we can provide outright gifts or grants. So this program has been very, very effective. We've made a lot of grants, and the program is picking up momentum. Part of the beauty of what's happened with this is the DOT didn't release their funds until later on in the year last year. So we were able to carry over the unspent funds from last year into this year and got a repeat of that grant. So we have a $616,000 package for this year. So it's an exciting event for us to be in the banking business and provide these zero interest loans.
Well, and zero interest, boy, you don't find that hardly anywhere anymore for anything. So that is a good deal. Now, are there other programs that WINR has that we didn't cover? I think there's the Oshkosh Community Back to School Fair.
Yes. That organization operates pretty much on their own. It's a committee that was pulled together, I think it was back in 1998, shortly after WINR got started. There were many organizations in Oshkosh that were making contributions to help youth prior to going to school with backpacks, school supplies, health products, clothes. And what WINR did was pull all that together and make one back to school fair much more efficient, much more effective, and they are now serving over 700, I think it was 750 children last year, and intending to do more in this coming year. So it's been pretty exciting. In addition to that, we organized a group up in the Fox Cities to do something similar, and they broke off on their own, but they serve a like amount of children each year with Back to School Fair.
You know, we touched a little on this before, Gary, but how do people go about qualifying for the Donated Wheels program and or the zero interest loan program?
Well, they have to be at 200% of the federal poverty level or below, and that's that magic point at which a family can become self-sufficient.
Sure.
And that is the objective of our organization, to help families become self-sufficient and independent. So that's why we use that. They have to live within a geographic area that we serve, and they have to need a vehicle for employment purposes.
Okay.
Again, we're helping them become self-sufficient. We're actually part of a recipe. We work with a lot of other organizations. We can't do it alone. You have to have job skills. You have to have a driver's license. You have to have a certain level of education. So all of that works together to make people self-sufficient. So we're part of a recipe there. Okay. Our process involves maintenance training and financial training as well. So it's not just getting a vehicle. It's some other skills that they pick up as well. And that's both in the financial, in the loan program, and in the Donated Wheels program.
And if someone wants to donate a vehicle to the program, Gary, are there specific cars that you are not willing to take? I mean, obviously, I would think you're looking for something that's safe, you know, but is there, you know, a restriction on what you would not maybe take?
What we're looking for are those cars that, with a reasonable amount of investment and repairs, can do 20,000 miles or 2 years of service, with the thought being that this family can use that and only put in routine maintenance for the first couple of years, and then if they need to replace it, they're in a financial position where they can do that. And that's why we set that 2-year threshold. If we get vehicles in that have major issues, then we're happy if the scrap values are high and we can scrap that out and use that to support the rest of our mission or ministry. So.
Okay. All right. You know, talking about donating cars, last year we heard so many people participating in the Cash for Clunkers program, or Clunkers for Cash program. There we go.
Yeah, it's Cash for Clunkers. Got it.
You know, how did that impact what WINR does at all?
The number is somewhere around 770,000 vehicles nationwide that were scrapped as a result of that program. There's about 17,000 in Wisconsin. Personal experience, being at some of the dealerships, large dealerships that we deal with, going out and looking at this vast open space where they used to have inventory, and then looking in a corner that they were going to send these vehicles off to be scrapped. It was an eye-opening experience walking through there. At least 30 to 50% of those vehicles would have been great WINR vehicles, program vehicles. So we anticipated directly after the Cash for Clunkers program ended that we would see a major decline. Actually, we didn't. For 2 or 3 months, it was still a very high level. But now, in the last 2 or 3 months, it really has dropped off. So we've seen a major decline. Now, what we've tried to do to offset that is we put a billboard up on Highway 41 just south of the 7641 interchange. And so we're trying to increase our visibility, let folks know that we still do need vehicles and would they donate a vehicle. And one of the benefits, by the way, of donating a vehicle to WINR is the fact that it stays in the community, stays here, helps your neighbors. So that's
So you
an
get to see it from time to
added
time,
benefit.
perhaps.
That's right. And we hear from people. I saw that family in that car.
Take good care of my vehicle. All right, good. Anything we didn't touch on that I know we just kind of grazed the surface here, but before we kind of switch gears here and talk to Steve?
I guess the only thing I would want to mention is that we started off as a faith-based organization and still are, but we provide support for anyone. There were 6 churches actually that got this going, and we are probably in relationship now with probably 26 to 30 churches in the greater Oshkosh area that support the program, as well as United Way, community foundations, and several other.
I would think that's pretty much all the churches, other than maybe some of the little tiny obscure ones that are just sort of like a neighborhood church or whatever that's just kind of starting up. So
it's a broad ecumenical support. So
okay. Excellent, very good. Well, let's talk to Steve now. A lot of our viewers might recognize you as you were on the police force for a number of years, and you hosted. You actually created, didn't you, Beyond the Badge, and you produced it, I think.
Correct.
So
With a lot of help.
yeah. Well, I know how much help this takes. You can't do it alone, just like Gary can't run WINR alone. So, but anyway, you're no longer doing that, but you're involved with WINR here, as we mentioned at the outset. You're the director of the Oshkosh Community Bike Program, and what exactly is that?
Well, really, in a basic form, a community bike program takes bikes in from the community and also takes abandoned bikes in from the Oshkosh Police Department. And then we have 2 groups, the Oshkosh Cycling Club and the Oshkosh Senior Bike Club, that are going to refurbish and repair those bikes. And then following that, those bikes will then go out through human service agencies to the community.
Okay. So obviously, if someone makes a donation of a bike, they can get a tax write-off. It's not as much as a car, but
There's a little bit of break
but
there.
there's a little bit of a break there. And these days, who doesn't need that? In addition to a bike, what else do you try to provide for folks?
One of the things that we're still seeking funding for is to do the second half of our program, because it's one thing just to give you a bike. You know, a lot of the bikes that we get from the police department are bikes that, number one, weren't registered, weren't locked up. And so to try and prevent that, we want to supply them with a bike lock. We're working with the city to make sure that all the bikes that go out the door are registered. And the other thing, as part of a safety thing, is we also want to provide them with a bike helmet. So before that bike ever goes out the door, we've already got $35 invested in that bike without sticking air or a new tire or anything else on it. But we feel it's really important to do a complete program in that sense, so that all the components are there, because you and I both know if I give somebody a bike, they're probably not going to go out and register it, they're not going to get a bike lock for it, or wear a bike helmet. So we want to encourage those things so that those bikes aren't coming back all the time because they weren't registered or locked up.
Sure, sure. Just out of curiosity, and you may not know, but you might, since you were with the police department for so many years, about how many bikes do they have on an annual basis that are never reclaimed by their rightful owners?
Probably several hundred, probably at least
Really?
200, could be as high as 500 or more. You know, and it's such a simple thing. It's a $3 fee to register it, and people just don't seem to do it. They go out and buy that bike, and it gets stolen, and then they go out and buy another bike and replace it.
Spend several $100s on a bike, but not the $3 to get
Right.
to get a bike license. And you know, some people may not even know that they're supposed to be licensing their
No.
bike. You know. Now, what kind of, you know, like you said, you can't do this all alone, so you need a lot of partners in the community. Can you give us, you don't have to name all of them, but just give us some idea who some of your
Well,
partners
the
are.
Oshkosh Area Foundation gave us some seed money through a community impact grant, which allowed us to go out and buy some initial bike tools, and we're just about there getting the shop set up. We've got a number of bikes in the shop right now and a number of bikes in a storage room. Our storefront was actually donated to us for a period of time from Jim Staple and Kits and File. Our storage was given to us by Richard Gabbett from AAA Storage. And so we've got some stuff there. Habish at Davis and Rotier gave us a $500 grant to get some helmets together. And I know I'm forgetting the Oshkosh Cycling Club. All 3 bike shops within the city have been real good to us as far as giving us some technical advice and helping getting us up and running. Like I said, the Oshkosh Senior Bike Club is going to do some bike fixing. The Oshkosh Cycling Club has been promoting our program, and also are going to be some fixers. We did gallery walk, which went really well. We had a lot of people come through the store. I'm sure they were just looking at the art, but we had a lot of questions about the bikes too.
Sure.
It was a good experience.
When did this program start up? Is this something that you started once you retired, or has this been going on for a little while?
Well, realistically, Gary and WINR started looking into it to see if there was a need out there. They talked to some of the human service agencies, because, why start a program if there's not a need? So he surveyed some of the area human service agencies, found out that there was a need out there. And then probably I came on January, February, and started working with Gary, looking at what other programs we're doing, looking at some of the things that we would be doing. Went out and talked to all the bike shops, because I didn't want to go out there and say, okay, we don't want anything to do with you because you're stepping on our turf. But they were real gracious. They were real helpful in making a lot of suggestions, helping us get up and going, and pointed us in several directions where we should go to make contacts. We've been out doing presentations for some of the human service agencies so they know what to expect. We visited a program up in Appleton to see how they were doing their program. We're probably going to mimic some of the things that they were doing. And probably our next goal is to get some bikes into inventory so we can put them out through a voucher process.
Okay. Well, other than that, now that the program is up and running, where do you see it going in the future, both short-term and long-term?
Well, short-term is probably the easiest answer,
Sure.
is to getting those bikes out there to the adults and children that need it, whether it be for transportation, employment, or even just being able to do those daily activities that you and I take for granted. Long-term, a lot of the things that we have in mind are something like an Earn-A-Bike program, where youth and adults can come down to the shop and work 10 to 15 hours, something like that, and they can go over and say, that's the bike I like, and because they've came in and earned that bike will be given to them. People around the community come down and volunteer some time, and since we have the correct tools, may be able to earn some maintenance time. We want to do some maintenance classes. We're talking about working with human services and being able to work with some of the kids that maybe need to look at a vocation, be able to come down and do some work in the shop. A helmet exchange program. A lot of times helmets get tossed in the garbage. The kid wore them for a year, but can we make use of them through our program? So we'll be able to take in a helmet and then give them a new helmet at a nominal fee. So there's just so many things out there that we can be doing with the program.
Sure. Now, like with the car program that WINR has, do people have to qualify then for these bikes, and how do they go about qualifying, if so?
Well, there'll be a couple different ways. One of the things we're going to do is trust in our human service agencies, that if they come to us and say, so-and-so needs a bike to get to work, or so-and-so needs a bike to get to school, and through that voucher system, they'll be able to bring that voucher in and get a qualified bike for that. If it's just an individual that comes in, we'll do an interview process similar to what WINR does, still falling under those same guidelines, the 200% of poverty, and then we'll go from there.
Do either of you guys need volunteers ever to do, as your word is, ministry? Or is this pretty much a self-contained operation?
We use volunteers at various times during the year. Our biggest use of volunteers is with the Oshkosh Community Back to School Fair.
Okay.
They use up to 200 volunteers to carry that out, and Kathy Cook and Bev Armstrong coordinate and bring in lots and lots of volunteers from the community. We have special projects. We do surveys to find out how good our services have been and whether we are doing the kind of job that we really need to do. Are people retaining employment or gaining employment? So we have folks doing surveys. We've also got a need for someone to do the high-tech stuff. A lot of us are at an age where we're not, twittering all the time, that kind of stuff. So we've got some young folks, some college folks, who are helping with that, and and we need more, and that's very helpful. Steve,
So techie gurus you're looking for
yes.
sure.
Oh yes, website folks and help there.
Actually, both of us can use a techie person.
All right, so calling all techie people. All techie nerds. If people want to find out, now do you have a separate email address or website for the community bike program, Steve?
Actually, WINR has one website that winneronline.com that you can go to.
.org, I think, isn't it?
Org, yes.
.org. And,
Sorry.
and on there is the Oshkosh Community Bike Program. And I have a separate email, which is, I gotta remember what it is now, OC.
Did you provide it to me at all?
Sure.
Actually, here it is.
Here it is.
OCBP, O for Oshkosh Community Bike Program, OCBP .winr, WINR, at TDS.net. That is a lot of letters. OCBP.WINR at TDS.net. So that's your email address, and then it's www.winneronline.org, where they can find out more about everything that we've been talking about here tonight. Anything else about the bike program that you think folks should know about?
Sure, if anybody has a bike out there, because I know this is springtime now, a lot of people are cleaning out their garages. If they have a bike to donate, they can do a number of different things. One, they can call me at 920-410-0308, and I'll actually come to their house and pick the bike up. They can send me an email of where the bike is, and I'll make arrangements to go over and get it. Or the 3 area bike shops have all agreed to be pickup areas. That'd be Wheel and Sprocket out on Washburn, Bike Outlet out on Washburn, and Oshkosh Cyclery on 20th have all agreed to be bike drop-off places. So whatever works, if they need it picked up, we'll make sure it gets picked up. If they want to drop it off, they can drop it off.
And so if they are going to one of those 3 places, A, good luck getting there with the road construction, and B, once you get there, be sure and tell them that it's for the community bike program.
Correct.
Okay, and then do they give them a receipt for tax purposes, or how does that work?
They'll let me know, and I'll make sure that they get it in the mail.
Okay. All right, excellent. Well, very good. It sounds like you guys are doing great things, and I'm so grateful to both of you for coming on tonight and talking about it.
Thank you for the opportunity.
Sure,
Thanks for having us on.
So very good. So that's going to do it for us. Thanks to all of you at home and to the crew and our guests from earlier in this hour as well. We will see you next time. Until then, take care. Keep your eye on us. We've got our eye on Oshkosh.